Today we're going to talk about the Mepilex AG border dressing for cesarean section patients. Today we're going to review the benefits, the inclusion, the exclusions, the application process, changing a dressing, documentation, and patient education. So first, let's review some of the risk factors for surgical site infections, or SSIs. So remember, some of the biggest risk factors for surgical site infections are obesity, hypertension, smoking, diabetes, or a history of poor wound healing. Now let's review some of the benefits of the Mepilex border dressing. For one, the Mepilex dressing has silver, which has antimicrobial properties, decreased blistering from the tape, decreased pain for the patient, and also the ability to assess the incision and reapply the dressing if necessary. Inclusion criteria has changed from a BMI of 35 and above to all C-section patients unless an MD opts out. The exclusion criteria for the Mepilex dressing is an allergy or sensitivity to silver. The application process is actually going to occur in the OR. So the dressing will be applied in the OR and a removal date will be added to the dressing. Now let's talk about the dressing assessment. So when you're assessing your patient's dressing, you want to look for if the dressing is 80% saturated or more. That will be an indication for removal. Another indication would be it no longer is sticking. If it's not sticking, you can pull it back. Just kind of use your fingers, pull it back a little bit, and then reapply. It should stick. Put your fingers down for 5 to 10 seconds. Use the heat of your fingers to create that seal. If it no longer sticks, then you will need to reapply a new dressing. Also, if the dressing becomes contaminated, you'll want to remove it. Also, if the dressing reaches the removal date of the 7 days, it will need to be removed. For documentation of the dressing, you'll need to document under your assessment flow sheet. Under incision, you want to document that it's the Mepilex dressing and anything that you did, if you needed to reapply the dressing or how the dressing looks. Also make sure that you're looking at the dressing together during your bedside handoff. So that way, if there is some saturation on the dressing, you can assess it together. So that way the oncoming shift knows how much has saturated on the pad. So if there's an increase, there may be an issue with the incision. Now let's review patient education. First, we need to make sure that the patient knows what type of dressing that they have. They need to know that they have a Mepilex border dressing on. They need to know to remember when to remove the dressing, which is that 7th day. A good rule of thumb for removal of the dressing is when the baby is 1 week old. Make sure you include the significant other or family members in the patient education of the dressing because of certain patient sizes, they may not be able to see the dressing. So it's really important that you include the family members in this so that they can assess the dressing and also so they can read the removal date also so it can be removed. So let's recap. So first of all C-section patients are going to be included unless a physician opts out. We've reviewed the benefits of the Mepilex dressing, the exclusion criteria of an allergy or sensitivity to silver, the removal date of 7 days. And then if you have any questions, you can also contact your learning specialist or your clinical nurse specialist. Thank you.